Okay, so good afternoon, everyone. Okay, so last few lectures we finish up the ruminant trichostrongyles. We also covered equine strongyles. So, and we little bit talk about the control strategies, but not in detail. In the previous lectures, how we can control strategies will be adapted to in the case of ruminant and equine nematode parasite. So today we will be covered these control strategies. So the learning objectives of this lecture, you will be able to explain the integrated approaches of parasite control strategies, especially the ruminant as well as equine parasites. You will be able to explain the problems of anthelmintic resistance and their impact on parasite control strategies. You will be compare the ecological as well as management factors that will be responsible for the parasite transmission. Also, you will be evaluate the refugia-based strategies that permit the control of these parasites, and that will helpful to reduce the drug selection pressure, and also you will be describe the optimal anthelmintic use that is further treat the livestock and horse at farm level. Okay, so how to control parasites? So first thing first, you have to change the attitude of the farmers, because they are mostly rely on anthelmintic drugs to solve the problems. So try to move toward the better management practices, better husbandry. How you can change this attitude? So there is one expert in American Consortium for Small Ruminant Parasite. They have some recommendation in their website. If you are more interested, you can go into this website and see what recommendation they will be give for the control of these parasites in ruminant. So, your goal, what is your goal to control or to eliminate these parasites? Could you able to eliminate these parasites? No, you can't. You can't able to eliminate these parasites, because these parasites are co-evolved within the host in millions of years back, and these worms are the normal part of the GI tract of all of these animals, like especially the grazing animals. Asiostomum, we talked about that one, is one of the example. Trichostrongylus, that is one of the example. So, do you need to treat these animals having the parasite infestation? So there's a number of different questions in your mind once you go with the control strategies. Is there any clinical justification? Think about any clinical justification for the treatment of these horses. You can also think about what parasite am I treating? I mean, we talked about a number of different parasites. Those are highly pathogenic. They need a treatment plan like haemoncosis or tildocygiosis or ostrigiosis. But on the other hand, trichostrongylus, they are less pathogenic. So you have to think about, and why do I pick this anthelmintic drug? So why am you going to use this? So these are the questions you can think about once you go into these control strategies or the treatment plans. How confident are you to anthelmintic will be work normally? Because resistance is one of the major problem. So this is one of the questions you have to think about. Any other option? Is there any other choice you can adapt other than anthelmintic? Just pick up the anthelmintic and treat the animal. So these are the number of different questions you can ask yourself once you go with the treatment plans or to control strategies. Okay, so then what you are trying to achieve here? So your primary goal is to keep these parasite infection below the level. because you can't eliminate them. You just take them in a level that will not be harmful for the animal, right? For example, haemoncosis. If the egg count will be is 500 or more, that will be a problem. So how you can reduce that one, right? So second, you have to preserve the these anthelmintics efficacy, because this will be very important resource you have. So don't use the anthelmintic in a very beginning just to be a magic bullet and say that, oh, this is going to work, right? So third, try to develop the strong immunities in the animal. So poor the immunities, higher the rate or risk of infection will be. So these are the main points or goals you have to think about. Okay, so how we can control these parasites? First thing, you have to you have much more thinking than just picking up the anthelmintic. So you have to think about a little bit more than that. You're required to change the mindset. So you have to think in a way like you know the parasite life cycle, you know the biology of these parasites, you know the distribution and epidemiology of these parasites. So you already know about these things because we discussed that one. But don't ignore that. You have to think in a way once you go into these plans that you know all of these things, then you can go ahead. Okay, so what else you have to learn? So there is a number of different lessons I will be in the next few slides I will be talk about. That is really important once you think about the deworming plan, when you think about the refugia strategies, etc. Lesson number 1. It is really important that it is normal and natural for animal to infect with parasite, because they co-evolve with each other. You can't able to eliminate them. So both should be present into the gut fauna, right? Lesson number 2. It is not possible for grazing animal to kept free for the GI infection. It is not possible, because these ruminants, they have raised with the host in millions of years. Worms has been there for millions of years, and these modern anthelmintics, they just here just for a few decades. So eradication of these worms is not possible. So you have to be think in a way that you are not eradicating these parasites. You have to reduce the infection rate that animal can't lose their productivity, right? Okay, so as I said, immunity. Develop the immunity against these parasites. There's a different ways. We know that in the young animal, the immunity is not much better. They can get the infection much higher. For example, like if you remember the case in our lab, like kids and does haemoncosis, the kids get more infection much higher as compared to does. So develop the good immunity against these parasites, right? Okay, so lesson number 4. Healthy animals with like low to moderate worm burdens, they do not require deworming, because deworming is not improve the health and welfare of these animals in the herd, because they are already healthy animals. So think about in a way that how you can select those animals those need treatment. So the health point of view, there is a little benefit for treating those animals who has low or moderate worm infection, right? So this is a very important lesson once you start thinking about the control strategies as well as treatment strategies. So these lessons are really important for you. So one other lesson in the farm: high number of animal per farm So more the feces, more the eggs, more the larvae contamination. So the number of animal in the farm is also important. So you have to think about how many animals should be in the one herd or in one farm. So this is also a very important lesson. So higher the number of animal, what is going to happen after that? Once the number is higher, more feces, more contamination. Also, the animal will get less nutrient that is available for that animal. So it means that more the animal in farm, nutrition rate may be low because you have a bigger animal size. You will not able to give the accurate nutrition to those animals. So it's important to manage these forage for these animals. So this is one of the important lesson. Okay, so lesson number 7, drug resistance. We talk about drug resistance a lot of time. So this drug resistance worm are not cause any severe disease that as compared to drug susceptible worm. The disease is caused by the worm burden. High the worm burden, more the disease will be, the more chances of the disease will be. There is no comparison between susceptible and resistant worm here. So if you have a parasite problem, you have to manage this problem with the farm management, improve the farm management, but you will not go directly to the anthelmintic drugs like a magic bullet and just treat the animal. So first think about the management practices. So we'll talk about more in detail in the next half. So in the modern farming system, how you can reduce the transmission of the parasite. For example, fences, little stock in the farm, which we already discussed. More the stock, more the nutritionist problem, more the larval contamination will be there. Little grazing in the pasture, that is one of the also a best source for reducing the parasite. Also switch the grazing every year. So you remember one of the video I showed you in Hamancosis, she just switched the what is called these fences areas from one year to the other year to reduce the infection. So these are the managemental strategies you have to be adapt. Not directly go into the anthelmintic, and you know that anthelmintics we discussed a couple of times, one of the huge resistance problems, so we will be very much careful before using these drugs. So in this last lesson, that is very important, where goat is a natural browser, right? As you see here, right? So on the other hand, sheep is also a browser if you give the opportunity for the sheep. So what happens if they will be browse as compared to grazing? Animal eat with their heads up, will ingest the larvae. So remember, L3 stage larvae is a contamination, is cause contamination. They are available. They are in the pasture, so the chances are high. So animal eating with their head down will get more larvae contamination. So this is one of the other strategies you can adapt in this lesson. Okay, so based on these lessons, it is necessary to appreciate all of these lessons and develop the sustainable integrated parasite management strategy. So who remember that we talked about this management, this sustainable integrated parasite management in one of the video, Dr. FIFA Milan, he talked about that strategy. So based on these lessons, you will be developed this strategy. So anthelmintic is one of them, but is not like a only component you will be use it, because it's a very, very important or valuable resource. Because the development of the anthelmintics is not like within a days. It will take years to get the new anthelmintic out in the market. And in USA, almost like a decade now, there is no new anthelmintics is in the market. The last one was the ivermectin, right? So that lesson is really important once you develop this sustainable integrated parasite control strategies. And we talked about in the endoparasiticide lectures all the anthelmintics, and this is one of the example I put it here. The most major 3 groups of anthelmintics we discussed in the endoparasiticides, and we discussed their toxicity and their dosages. Okay, so based on these strategies, deworming approaches to control the parasites, especially the nematode parasite in ruminants, how we can do that. So there's a 2 type of approaches, either rotational deworming approach or multiple anthelmintics in combination. So these are the 2 approaches. So we can discuss about the pros and cons of these 2 approaches and which one is better to adapt. So rotation. I think rotation is illogical. Why? What you are trying to do here, you are switching from one drug to that is not going to work to the drug that goes to work. And resistant worms are very common. We know about that. And the rotation does not prevent the resistance. How you can prevent the resistance if you rotate these anthelmintics? You can't. They are there. So what will be the best option here? What will be the best option? Sorry? Use the combination. So use the anthelmintic in combination, right? Use the full dose of each anthelmintic, but administered separately. Don't mix it. So now I can give you one example how this combination works. So let's hypothetically assume without using the name of any medicine. So this is treatment A, like medicine number A. Before that, these brown are the susceptible worm, blue are worms resistance to drug A, this pink color resistance to drug B, and the red resistance to A and B. So what you can do here, you can just use this drug number A. In that case, all these susceptible will gone, and the resistance to drug B is also gone because they are not resistant to drug A. But this red color, they are resistant to both, and A is resistance to only drug A. They will be survive here, right? If you can gonna use this drug B, susceptible gone, and this blue resistance to A is also gone, but these 2 will be survived, like pink and red, because this red is multi-drug resistance worm. Okay, so if you use the combination of both, what is going to happen? This will kill the blue, and this A will kill this pink. So only red will be survive. So it means that you are not eliminating these resistance worm, but you are reducing these worm with the combination of drug. In a different form, is a different scenarios. You never know which drug is resistant, which one is not. So this combination will be work there. Most probably it should be the best option there, right? Any confusion here with the combination of drug? Anyone has any question? No? Okay. So anthelmintic combination, these are the number of different combination in ruminants, like levamisole and moxidectin. They are most likely to work. Benzimidazole and moxidectin, they are also work. Benzimidazole and ivermectin, they least likely to work because benzimidazole resistance is massive, and ivermectin is also more common as compared to moxidectin. Moxidectin is in a much better situation in the microcycle lactone group. Ivermectin and moxidectin, because they are the same group, but moxidectin will work more better and kill the ivermectin resistant worms. Once you have a low level of moxidectin resistance, on the other hand, ivermectin will not work. So that's the problem in this drug, and the reason we really don't know how this moxidectin is more potent, even kill the ivermectin drug, and on the other hand, low level of moxidectin resistance, ivermectin is not work. So because they are same group, same formulation, but this is what the output of these two drugs are. Okay, so just do some question. Can you take it out your point solution? Let's see what you're understanding up till now. Okay. So, what is the best strategy regarding the controlling worm and delay the development of anthelmintic resistance in ruminants? Okay, so yes, use two or more drug in a combination at the same time. Okay, so let's discuss about the deworming approach in the case of horses. Again, traditional deworming approach, rotation or combination of the drugs, dewormers. This is one of the other approach. Anthelmintic through prescription. So these are the three approaches has been used in the control of these horse parasites. Let's see which approach you think is the best approach. Let's start with the traditional approach. So this approach is the interval dose program. It was started in 1966. Who gonna tell me the life cycle of Strongylus vulgaris? Is this okay? Let me give you a hint. 21 days, 3 months, 6 to 8 months. 6 to 8 months. Yes. Okay. So I wrote it down here. 6 to 8 months, weeks. Sorry, weeks, not months. Weeks. Okay. So this drug is this particular strategy is for the control of Strongylus vulgaris. Why? Because you know the treatment of this, the life cycle is 6 to 8 weeks. So what has happened? The first drug was introduced at that time is thiobendazole, is a benzimidazole group. And this drug has no efficacy against larvae, but this drug has a very strong efficacy against adult. So now, if you have understanding of the life cycle of this parasite, and you know this is 6 to 8 weeks, you can easily understand why this deworming work in this group of parasite. So what happened? This parasite will go. Who going to tell me is this a migratory or non-migratory behavior of this parasite? Migratory, and in Strongylus vulgaris, where they migrate? Cranial mesenteric artery. So once it converted into L5 stage, it goes back into the large intestine. It will take 6 to 8 weeks. So because this drug is worked against adult, and then once they reach into the large intestine, you can treat the animals. What is going to happen? 6 to 8 weeks. If you treat the animal, this drug has a strong efficacy against adult. So once you treat this animal at the 6 to 7 week, what is going to happen? Kill the adult, because this L5 migrate back into the large intestine from mesenteric arteries, right? And then you can treat every 6 to 8 weeks. So if you treat 6 to 8 weeks, after that again 6 to 8 weeks, because the adult will go into the large intestine, and they will stop once the adult kill, eggs production will be stopped. So that strategy worked perfectly in the Strongylus vulgaris or Strongylus. What I said about the Strongylus, is this a common parasite anymore? Is this a highly prevalent? No. So these are the 4 reasons why this approach is now failed, because Strongylus is not a very common parasite, no longer a primary target. Cyostomum, on the other hand, less pathogenic but more prevalent parasite. And what is the difference between the biology of these 2 parasites? Basic life cycle. Who gonna tell me? What is the difference in the life cycle of these Cyostomum and Strongylus? Yes, you are there. They don't migrate. So that's why the biology is different. This approach will not going to work in Cyostomum. And what else? Thiobendazole, that was the drug used against Strongylus, is not a choice in this case, because the Cyostomum shows resistance against this drug. So if there is a huge number of egg shedding on the posture despite of use this thiobendazole drug. So it means that strategy is not going to work here too. Thiobendazole also not kill the insisted Cyostomum larvae, because thiobendazole is kill adult worms, and these Cyostomum are normally make a cyst formation. So most of these Cyostomum in the adult horses are in the cyst stage. So this strategy is not for Cyostomum. Cyostomum is the most important and most prevalent parasite nowadays. So this strategy is not going to work as long as you will be treat Strongylus if that is the problem in the herd or in the horses. Okay, so let's discuss rotation. Again, what do you think about rotation? Is not, from my point of view, is not logical. Is not possible to become to be lead to fail the worm control program based on this rotation. What happened? It will create a false presumption between you and the owner. How? Resistance. I mean, if the resistance rotation will be mask the resistance, right? And this drug resistance is extremely common. We know that, and you and the owner do not realize that the resistance worm is in the horses. So that is not also a best option or good option. So what else you will be think about now, being a veterinarian? Any other approach in your mind? Combination, right? So combination of the drug become a best option here. So must determine which drug are effective on this particular form, because you are using a combination. So you will be able to treat these strongyles as well as roundworms in the case of ruminants. So combination is also a best strategy in ruminants. So both approaches make the best choice of each drug at a if you use in a particular time point of the year, if you will be used in a particular animals, and we'll talk about how you decide that this animal I will going to treat in the refugia management strategy. So also target the particular parasite stages. We know that tricobendazole will be work in the adult, not in the cyst, and is not going to work in cyostomum. Okay, so these are some of the so one more point. We discussed a couple of times that is not a companion animal you are dealing here. You have to wait and see what is going to happen with the outcome of these drugs. Fecal lag count reduction is also a good practice to be do in the horses. You know you have to do that one in ruminants, but is a good practice to be doing in horses. So these are some of the combinations. For example, like tricobendazole is resistant to cyostomum. So these are number of different combination like ivermectin, oxybendazole, fenbendazole plus parental, oxybendazole or fenbendazole and plus parental. So these are the some good combination you can able to use in the practice. So finally, anthelmintic through prescription, because normally farmers use their own ways to these anthelmintics. So this legislation was done in Denmark a couple of years, 1999. Now the treatment will be given by the prescription of veterinarian based on the diagnostic results, knowledge of the parasite, strong suspicion of this infection. So now this legislation is also adapted the other EU countries like Sweden, Finland, or Netherlands. So this is one of the other option to be involve the veterinarian first before the farmers can do any treatment plans. So drug resistance in livestock. You are familiar now that drug resistance is one of the major problem in small ruminant and one of the emerging problem in the large ruminant like cattle. So resistance to all these major drug class are very common. So that's why sensible use of drug is the best strategy, and this is the lesson we discussed about. And there is no product approved in USA containing any anthelmintic for a new drug class since 1980. That is the ivermectin was the last one. So think about how important these drugs are. Duraquintal, that was recently introduced in Canada. So the consequences of this anthelmintic resistance reduce the efficacy or the benefit of the treatment in the animals, also reduce the health and production losses that will be threatened. So these are some of my work. I did it in my career about the anthelmintic resistance in ruminants, and this one I already showed you that this is this resistance in sheep and goat in USA, that is a huge problem. Benzimidazole is very high. Levamisole is still better. Ivermectin is high, as well as moxidectin is still in a better form. So these are some of the things you have to be understand in the treatment plan. So in the cattle, one of the emerging problem. Previously we thought is fine. We can treat the cattle with this single drug is fine, but now is one of the emerging problem. So is in the cattle industries. So we published this data a couple of years back in Florida and Georgia. So resistance against Haemoncus in cattle is one of the huge problem there. So again, anthelmintic resistance in horses, one of the biggest issue, and cyostomum is one of the classical example here where resistance is emerging very quickly. Okay, so now what's your recommendation to reduce the anthelmintic resistance in ruminant and horses? Because the resistance is there, resistance worms are there. How we can adapt the strategies to reduce these resistance? Refugia management strategy. So you heard this word, but I'll give you the flavor how how this refugia management work and what is meant to be this targeted selective treatment plan in the refugia management. So, what is refugia? To delay the resistance, to reduce the treatment frequency. So, the proportion of the worm population that is not selected by the drug treatment. It means that you will not treat all these animals in a one single go to give the exposure, and the selection pressure will be increased. So reduce the drug selection pressure to manage the refugia. This is how the refugia work. Failure to manage the refugia, it means that development of the resistance will be there. And manage the refugia mean maintain the majority of the drug sensitive worms. So this is how the refugia strategy works. So this is one of the example I can give you how this refugia based strategy work. Let's say you have eggs in the feces, adult are in the host, and the larvae are in the grass. So red are the resistant worms or eggs or larvae. If you give the drug first time, there are two here. If you give the drug in the second time, they will be increased here and here and here. If you give the third time, they will further start replicating because they are resistant worm. The drug will not affect them. So you are giving them an opportunity to be further replicate. So it will be increased. This is how this refugia based strategy works. So what you can do here, how you can adapt the refugia. So give the drug first time, let's say, is red here. Just don't use the drug anymore. So sensible use of drug, this is what it means. So then it means that the resistant worm will not be further replicated because you will not give the selection pressure to the worm to give the drug and they can start replicating. Right? So this is how the refugia management strategy work. Anyone has any confusion about refugia strategy here? All clear?
So you're basically just treating whether or not they just do a fecal egg count and then determine off that whether they make a dewormer or not?
Yes.
So that's essentially what
Yes. Yes, exactly. So lesson number 4 or 5, remember. So yes, this is what we are trying to achieve here. Mm-hmm. Okay, so
targeting the resistant worms or non-resistant worms?
So they will be target all the worms. The drug, because refugia management you are giving the drug multiple time, but in that case the susceptible worm maybe die because of drug, but the resistant worm, what they're going to do? They will not going to die. They will be start replicating. They will produce the eggs. So it means that at the end of the day, in the contamination of the larvae, you have more resistant worm as compared to susceptible worm. So you are giving the exposure to these worms to be just survive and reproduce. Right? Make sense? Okay. So targeted selective treatment strategies in the umbrella of refugia management strategy. Selective non-treatment in the case of cattle. What does that mean? Treat most but leave some of the animal in the herd untreated, like 10 to 15% or 20%. So how you can do that? How you can leave these animal untreated? You can't do that based on the pharmacia or fecal egg count test, because these are big herds, like cattle is the big animal. This is not, it's difficult to obtain the feces and do all these pharmacia and fecal egg count. So best strategy, leave the best looking cattle untreated. This is one of the best strategies you can adapt here. These animals has least impact by these parasites, because they are not likely to gain any benefit if you give the anthelmintic to these healthy animals. So leave these healthy animals separate and treat those who need treatment. In the case of sheep, the strategy is a little bit different. you will go with the selective treatment strategy. For example, in the case of Haemonchus, you can go with the pharmacia. That is the best option. You can check the animal which is become anemic, separate it out, treat those animals. In other GI worms, you can go with the fecal egg count by the way, or egg, or body conditions like this, and diarrhea score. So this is also one of the option you can adapt and separate those animal who need treatment are also based on the weight. How many animal are in the low weight, or how many animal are in the gain their weight. Those who are gaining weight, it means that they are healthy animals. They don't need treatment. Right? So these are the number of different ways you can adapt these targeted selective treatment strategies. So fecal egg count, we will be perform the McMaster in this coming lab, and mini float is one of the option. And you remember, mini float is the best for cattle, much sensitive and the McMaster is good for sheep and goat. So how much refugia is enough? So that's one of the questions. So the size of refugia is depend on the efficacy of treatment. Very important statement. In sheep and goat, if you use this pharmacia for haemonchosis to identify the animal they need the treatment, so you will be treat only the proportion of those particular animal in the flock, not the one whose pharmacia score is better. In cattle, you will be select the animal based on the healthy animal in the flock. Right? More the refugia, less future resistance, and more future productivity. Oh, sorry. So again, exactly the same strategy, refugia strategy in the case of horses, the one we discussed in cattle. So how you can implement the targeted selective treatment strategy in horses? We talked about the selective treatment and selective non-treatment plan. Selective non-treatment plan is best for cattle. On the other hand, selective treatment plan, only fecal egg count is the best method for the targeted selective treatment in horses. Other than that, the rest of these plans are only for the small ruminants. So in case of horses, just go with the fecal egg count and decide which animal need a treatment and which animal don't need a treatment. And also go with the 14 days post-treatment to look if your drug worked or not. Okay, so just which of the following has the biggest impact on the size of refugia that is needed? Okay, so the efficacy of anthelmintic treatment. So the number of animal in the herd is not matter. It is all depend on the efficacy of anthelmintic drug. Okay, so most important factor involved in the development of anthelmintic resistance. Okay, so yes, failure to manage refugia. So what is the best strategy for farmers to use anthelmintic drugs on their farm? Yes, so fecal egg count reduction test. So, final recommendations based on the lesson we learned, based on the dewormers we used, and based on the resistance, based on the control of these resistance, based on the basis of refugia management. Final recommendation: use anthelmintic, but use it wisely. Implementation of these sustainable integrated approaches is important. Better to start earlier. Benefits are higher when these strategies are used before the resistance problem developed. But resistance problem is already developed. So just to be think about now, once the new drug will be come in, we have to change our habits and adapt these strategies to reduce the drug selection pressure and reduce the resistance in the animals. All evidence, what will these strategies slow down the development of resistance? Yes, this evidence are reduce down the development of resistance. But you and the farmers, they need a partnership. Create a strong relationship between you and the producer or the farmers to solve these problems. So these strategy will be result into the better management that will be benefit to the animal well-being, consumer confidence, and the producer profit. So these are the most important final recommendation for the control strategies of the strategies in ruminant and horses. Okay, so anyone has question? Yes.
This is probably stupid. I just need to make sure I know what the definition of refugia is. So this is what we're calling the population of worms that we're not currently treating, basically. So like the animals we chose not to treat at this moment that had worms, those are refugia. And then the worms that are just like, if you don't like treat the property or whatever, so the worms that are just there, that's refugia.
Yes. In simple way, let them there without treatment. The resistance the development of resistance, the chances for the development of resistance will be go very, very lower. Exactly.
Okay. Because you're giving less drugs in general.
Exactly.
Okay. Great. Thank you.
Anyone else?
No, I do not know.
Sorry.
So whenever you're saying like a partnership between the like farmers and the veterinarians, so I mean if they're having to do these like fecal egg counts and stuff, like how realistic is that to like tell the farmer, hey, why don't you do this instead of just treating worms realistic, like willy-nilly? So I don't know, what would be your recommendation?
So every veterinarian has a different strategies. So the relationship, this is the way you have to develop with the farmers, that how you can convince the farmer, okay, let's try to do this way. Let's try to, this is the building of a relationship. So every person has a different way to adapt these relationship. So then you have to decide how you can develop this relationship and convince this farmer, okay, you can do this fecal egg count, or let's say in cattle, which animal we're going to treat, which animal we will not going to treat, based on the body weight of these animals. These healthy animals, we don't need treatment. How you convince the farmer these animals don't need treatment? But because sometimes farmers, they want to treat every animal because they want to increase the production. So you have to convince them. Yeah. Anyone has any other question? Before we can wrap up? No? Okay, thank you.